I spoke about was the journey that we're on to try over the next 4 to 5 years and beyond to use information technology and data much more effectively across the health and care system. The first is around automating or putting much more technology into providers, hospitals, etc. Secondly, that we've got to get information to flow around the system. I described that as getting the NHS to talk to itself. Thirdly, I talked about data and better uses of data and balancing that with the need for public trust. And finally, I talked about digitizing the patient experience. So when you and I want to interact with the health and care system, we can start to do that in a more digital way like we can with most other industries in our everyday lives today. So the Secretary of State is a big proponent and fan of the use of technology to make the patient experience better, to make the clinicians and other people that work in the health and care system better, and as a result of doing that we can do much better as a health and care system to respond to the sort of demands that we've got because we're all living longer and we're having multiple diseases and so on, all the sorts of things that lots and lots of people know lots and lots about. I think the big challenge we face is really, it's kind of a twofold challenge. The first is just the scale of it. We're talking about a huge enterprise called the health and care system. Over 2 million people work in it, million plus in the NHS, one of the largest employers in the world. And if you think about it, just a single hospital is a large organisation, and there are 200 of them. So the scale is an issue, obviously. I think the second thing is that where are we today varies a lot. You can go to GP practices where the use of technology is very good indeed. Bob Wachter described that as world class. You can go to hospitals that are very good in their use of technology, and you can go to others that are not at all. So the variability and the fact that we've got to bring everybody progressively up to a similar high standard over the next few years is the other aspect of the challenge. This is the third time I've been here, and it's buzzing much more than it was last year and much more than the year before. So that's a great thing because people are starting to engage much more. I think the agenda is very much that technology is really important as we try and change the health and care system. So I think that's the most important thing, and getting people to talk about it has got to be a great thing.